why is it important that prescriber prevails be restored to the New York State budget?
Well, when it comes to the situation of women being able to access contraception, right now it's taking medical providers hours to get pre-approval to use drugs that are most effective for people on Medicaid, rather than being able to see additional patients. So we're losing the ability for patients to be seen. We're losing the ability for patients to get the best drug therapies that they need to be able to live most successfully in society. Fail first means an unintended pregnancy. Contraception's purpose is to prevent pregnancy. Now, oftentimes women try multiple different forms of birth control until they find the one that works best for them. We also know through studies year after year that women are more successful in staying on a method, and the method being successful for them when it's a method that they choose. If in fact you're moved to a formulary that doesn't cover that method any longer, whether it has a unique delivery system like a patch or a ring, or whether it's a certain pill and you can no longer access it, and they're saying you need a fail first methodology, which means you need to try one until it fails, and some are asking for two, which means two unplanned pregnancy. We're in the direct antithesis of what this medication's purpose is, and that's to prevent pregnancy. And New York State has had a very long legacy of supporting women with the full range of access to all FDA-approved contraceptive methods, and we'd like to see that come back.
Best case scenario, what happens at the end of legislative session?
Best case scenario is that with regard to contraception, the full range of contraceptive methods that are approved by the FDA are back in all formularies. The reason that this is cost efficient and effective to the Medicaid managed care plans is that the federal government reimburses New York State 90%, so 90 cents on every dollar. So it doesn't cost the state or the insurance companies any more to provide those different methods to women. And that prescriber prevailed language finds its way back into our Medicaid laws, so that at the end of the day, that patients and their medical providers are making the decisions and the drug regimens that are best for them to be successful in our society.